Hi, my name is Etan and I'm a psychotherapist with a practice in Park Slope in Brooklyn. Since you're watching this, I'm going to guess that you or someone who you know has a problem, and you're trying to make a decision about therapy. If I were in that position, I'd have a few questions I'd want answered. They'd be something like this. Can my problem, or the problem of someone I know, be helped with talk therapy at all by anybody? Best person in the country. Does this particular person have the skill and understanding to help me? What's involved in treatment? What is treatment actually like? And how expensive is this going to be? Now, of course, because I'm speaking to you on a video, I can't answer these questions. I don't know what your problem is. And because of that, I offer a free, no-obligation consultation, either by telephone or in my office. And if you take advantage of this, you'll get a chance to meet me, to know me, and to allow me to give you the answers you need to make an informed decision. I urge you to call me during business hours at 347-844-0071. Again, 347-844-0071, and set up either a telephone or in-office consultation. And I think you'll find it hugely helpful. In the meantime, I hope that this video will give you an idea of who I am and the type of therapy that I practice. There are a lot of different kinds of psychotherapies, but they fall into two basic categories. Most therapists in New York are from one. They practice some form of insight-oriented therapy. And the major goal is for you to understand yourself better and so have a better ability to deal with life. The most popular of these is psychodynamic therapy, which has its origins in the psychoanalytic research of the past century. Now, treatment usually includes a detailed exploration of your past, of your childhood, in order to understand how that past affects you now. It's a long-term process, and it often lasts many years. And patients really shouldn't expect much focus on their immediate problems. There's nothing wrong with these insight-oriented or psychodynamic psychotherapies for the right patient at the right time. And I'll argue that they're especially good when a patient's problems aren't too severe. When the patient comes to therapy because he or she is bothered by a sense of malaise, a vague anxiety, a general dissatisfaction with life. At the same time, their job should be secure, their marriage or social life should be stable, they should be functioning without major threats, major problems. The type of psychotherapy that I practice is very different. It's a combination of cognitive behavioral therapy and schema therapy, and it's a very practical short-term approach. My assumption is that patients start therapy because their symptoms feel urgent. Their problems have begun to affect their ability to cope and to function and to enjoy life. And my goal has to be to get them back on their feet quickly and as quickly and efficiently as possible. And after that's done, we can look at what's needed to prevent the problem from coming back again. Most people come to therapy with major depression or an anxiety problem. And both problems can result in a person being unable to work or function in their family. And that's a very serious situation that I need to take seriously and respect. As a result, I want to use methods that have been what were called empirically validated. And that's a technical term, meaning that they've been tested in clinical trials similar to those used in testing new medications. We know they work. After interviewing you and coming up with a diagnosis, I can tell you what protocol I want to use and the percentage of patients who are cured or who get significant relief after however many sessions the protocol runs. I can't guarantee my work, but I know my batting average, and that's what I can share with you. I usually ask my patients to take on some form of objective monitoring of their symptoms, or to answer questionnaires that measure severity of symptoms. I like to have an objective measure of where we started so I can tell how much progress we're making or we've made. Most of the protocols that I use result in significant improvement for 75% of patients in roughly 20 sessions, or maybe less. In real-world terms, that usually means 6 months of treatment at a cost that's less than a new transmission for your car. And I recognize that for some patients, therapy feels very expensive. Though I try to keep costs reasonable, I'm never going to be a cheap therapist. That's out of the question. You don't want a cheap therapist. You don't want cheap therapy any more than you want a cheap tattoo. I think that says it all. So what makes short-term therapy short-term? It's focused on what you think and what you do in the here and now. It's active therapy. I give my patients homework assignments that I expect them to do between sessions. These can be relaxation exercises, they can be meditation, changing their sleep patterns. I can send them out on missions to challenge their fears or to behave more assertively. There are hundreds of possible assignments and interventions, and these make a huge difference. Much of our time together goes into reviewing homework results, figuring out how to improve outcomes, and coming up with new homework assignments. I don't relate to my patients as a distant professional. I relate to my patients as an expert, a teacher, a collaborator, a trainer, or a coach. Now, not every problem can be taken care of with short-term therapy. Problems that start in adult life in response to a specific stressor are easier to treat. Problems that have been lifelong, especially those that start in early childhood, are much more difficult to treat. And it's ironic that a severe depression that threatens your ability to function at all is actually easier to treat than a chronic low-level depression that you've learned to cope with. Panic attacks and phobias, as horrible as they can be, are easier to beat than chronic worrying since childhood. And this isn't just true of psychotherapy, this is true of all forms of therapy and all forms of treatment, and that actually includes antidepressant use. Now, you may hear this last part and think it's bad news for you. It really isn't, or it's not terrible news at least. Developments in cognitive therapy over the past 15 years, particularly developments in schema therapy and CBT, now provide us with ways of treating problems that most therapists used to think of as incurable, such as borderline personality disorder. Treatment isn't just short-term, but outcome rates are very good. And most of the patients really improve in terms of their ability to function in their work and family life. Treatment of dysthymia, which is that chronic low-level depression, social phobia, which often begins before school, chronic generalized anxiety, and the personalities, including borderline, usually run 2 years, but it's worth it. It makes such a huge difference. It's really worth it. I'm not sure how much you've learned from this little video, and I hope you'll take away the idea that I provide a kind of active therapy that focuses on patients' problems and that delivers results. Again, I'd like to offer you a free, no-obligation consultation, either on the phone or in my Park Slope office. It'll give you a great idea of what I'm like in person when I'm not reading from a script. And it'll give me a chance to evaluate your situation. You should come away with a preliminary diagnosis, a general outline for treatment as I would do it, and an idea of how long treatment will last and how expensive it'll be. To take advantage of this, please call me during business hours at 347-844-0071. 347-844-0071. I feel like I'm pitching shampoo or something, or I don't know, one of those Pitchman commercials. 347-844-0071. I'll schedule the free consultation. Do it today.